So, Congressman, first of all, it's now that we're a week or so past the election, what are we going to do about health care? You, as a medical doctor, have been very outspoken on this, and many doctors have been. What happens now?
Well, here's one of the unfortunate truths of the so-called Affordable Care Act. You know, the darn thing in its entirety just doesn't work. And so there are multiple pitfalls ahead. Just look at the rules that were delayed in advance of the election, so the president and the administration wouldn't have to be talking about them. The biggest is the rule affecting the essential health benefits that the state exchanges are going to, that regulates the type of insurance that they will have to sell and what it will cover. The states are required really within the next few days to divulge their plan for the state exchanges, but right now they don't know what they're going to be required to cover because the essential health benefits are not going to be disclosed till sometime right toward the end of the year. This is a major problem for the states, because now how do they budget for what their state exchange is going to cost them if they don't even know what they're going to be covering? There are other things as well. The Medicaid expansion is one of those, but it gives the states, it puts them in a terribly difficult position.
The thing about this, there's been an uproar, of course, about Obamacare, but really the parts that a lot of people like are the parts that have been implemented so far. So if there's been already an uproar, the not so nice parts, the costs that you're talking about, are going to start kicking in January 1st of 13.
Right. Some of the taxes have already kicked in, but next year is a big one for the taxes in what I call the Unaffordable Care Act. The payroll tax, the 0.9% surtax on the Medicare payroll tax that kicks in January 1st for people who earn over $250,000 a year. Certainly the 3.8% tax on unearned income for that same income bracket. I mean, that's going to start affecting a lot of people. And then here's the really bad news. None of that is indexed for inflation. So over the next 10 years, that's going to loop in a lot more people. We'll have the same problem that we have today with the alternative minimum tax that has to be patched every year. Again, there were so many problems in this thing. When Nancy Pelosi said we have to pass a bill to find out what's in it, that wasn't just apocryphal because of what was contained within the law itself, but now all of the rules and regs that are being written, all the places in the law where it says, and the secretary shall, we're essentially talking about Secretary Sebelius, Secretary Geithner over at Treasury, and then this little known federal agency called the Office of Personnel Management, which is now going to run what used to be called the public option. States like mine in Texas that don't set up an exchange, there will be a federal exchange set up through the federal government. This thing is command and control from the top down right the way through. And the thing is, it didn't have to be this way. You're right. You referenced some things that people did want as far as reforms. Those were possible without turning the entire healthcare world on its head, and certainly without blowing up the federal budget. This thing costs $2.6 trillion over the next 10 years, and that's money we simply do not have.
Is there any talk in the hallways, the back rooms? Do other members of Congress from either side of the aisle, especially since you're one of the few doctors in Congress, come to you and say, we need to change some things, or do we need to change some things, or what do we need to change? Do you expect change?
Well, to answer your first question is yes. There are a number of us who talk on a regular basis about this. Now, of course, the outcome of the election was not known until just recently, and a lot of the discussion was based upon perhaps a different scenario than we face today. But there are going to have to be discussions. And look, I've reached out to the administration literally 4 years ago during their first transition. No one there wants to talk to any Republican. I don't know why. I mean, Governor Romney, when he was running, at least said, I'll be willing to reach across the aisle and work with members of Congress who don't philosophically agree with me. But this administration has shown no appetite for that. I don't know if that will change. I guess I hope that it does. But honestly, at this point where we sit today, it hasn't happened. And I'm not optimistic that it will. There are groups of people that are working on this, and I'll tell you, one of the biggest groups that will have a big say in this will be our national governors, because the governors are the ones. I mean, they're the guys the cops on the beat, if you will. They deal with health care in their states at a very personal level. Yes, they've got their state plans that insure their state employees, but they're responsible for administration of this Medicaid. Whether they expand under the federal guidelines or not, they still have a big piece of health care in their states, and they were never consulted when this thing went through.
Well, I'd like to stay in touch with you on this, because as it progresses, I expect that we will get we will get some kind of changes. It doesn't look like it's going to work under the current system. But Dr. Michael Burgess, Congressman Michael Burgess, thank you so much. Appreciate it.